So what does it take to become a pain management doctor? So I get to this question a lot from residents, fellows, and even from patients. So I'm going to go through what my process was and what some alternate processes of my colleagues are. So first, you start out in college, you usually will major in some kind of science, but one of my partners, Dr. Westrauss, he majored in engineering. So you can really go through any science to get through college. And then the next step is to go to medical school. Yeah, everyone has to go to medical school. You can go to a DO medical school or an MD medical school, and that's 4 years. After that, you need to do a residency. And there's a lot of different residencies that can pour you into the next step of fellowship in pain management. The two most common are physical medicine and rehab, or PM&R, and then anesthesia. I'm a PM&R doctor. The difference between PM&R and some of the other ones is that we really focus on the body. We focus on every muscle, every nerve, every movement. So for that, I'm really happy to have that background because it helps me really see how patients move and how they interact with their environment when they're in pain. You can also go to family medicine, neurology, really any type of residency that is looking at the patient and knows how to treat pain. You then have to get accepted into fellowship, and the fellowships are pretty generalized across the nation. There are some ACGME accredited fellowships, there's a NASS accredited fellowship, and then there's a lot of unaccredited fellowships as well. And these fellowships all have different things to offer from different locations in the country, treating different types of patients. Some focus on opioid management, some focus on just injections and advanced procedures. And after you've done all that schooling, 4 years of college, 4 years of medical school, 3 to 5 years of residency, and another year of fellowship, then you're a certified pain management doctor. And at that point, you still continue learning. We go to conferences every year. We do webinars every year. We're teaching residents, which actually helps me learn, and we're teaching fellows. So that's the basics on how to become a pain management doctor.